So at this point we've already created the vestibular extension. You'll see that this is the unattached mucosa, and the idea is to connect this area here to the gingival crevice, so that in essence we have a flap, but the flap, instead of being attached at the base the way we normally have one, it's actually attached at the sides. So that's why we call it a lateral bridge flap. Okay, so now this allows us a completely tension-free flap to cover the AlloDerm with. Okay, so now that we've actually connected these spaces, now we'll work on placing the AlloDerm material underneath. So this is the AlloDerm graft. So AlloDerm is basically human donor tissue, freeze-dried acellular, so there are no cells, so no transference of any kind of bacteria or virus or fungus. This has been hydrated in the PRGF, and when it's dry it looks like a piece of paper towel. So we're basically tucking this underneath. And now that it's there, the next step will be to suture the AlloDerm and the corresponding flap. Again, let's pierce the flap as well as the AlloDerm. You can see the AlloDerm underneath here, slightly. And then once we complete the suture, you'll notice the tissue rise. And one of the more important things that we can already notice is that when I pull on the lip, you'll basically notice that there is no tension whatsoever on the graft. We're not done. I'm going to place a few small sutures just to stabilize the base of this flap, but you'll notice that the objective has been met. The reason why most of the free gingival grafts, the ones from the palate, are used is because they have no choice many times but to patch the tissue over the existing tissue, which leads to an unattractive sight and a painful palate. But using this technique, we basically have bypassed all of those potential complications. So here we have the final surgical result. AlloDerm is underneath the flap, and the last step, final step, is going to be to actually inject some of the growth factors taken from his own plasma underneath the flap to accelerate healing even further. Little pressure. We'll hold that pressure for a few minutes, and then we are all set.